Evan be Ijom Ishog. I gather milk. No, I agree, Mam. Majessa. I will let you cook whatever wildness happen.
Ocho ye gaduma, ele ada jodaduma, ele ocho ye gaduma. Yo ele yeah.
The health system in Nigeria is not doing good.
The state of health in this nation is unfortunate.
Every ward should have a primary health center.
Government is doing something, but nothing is happening.
I find they never pay me for my pension. How can I get money to care for myself?
We don't have an ambulance. You can see our ambulance there. It has been like that for years.
We have to find mechanisms to get the resources down to the local level, better partnerships.
It is unfair that our women will die in the process of bringing another child to the world. It is unfair that the children that are born are dying like chicken.
It's money. And that is just that. Unless we understand that we're there to save lives.
Let's call on the Nigerians to help us.
Who really is government? Who is government? Who are we really talking about whenever we point our fingers and say, government has not done this, government has not done that? We should begin to ask ourselves.
People have lost faith in government. People don't believe.
There's a need for the government to embrace the civil society organizations because they are those that are most closest to the people, and the people actually know that they feel for them.
It's important that we note that the government is also in a very dicey situation in terms of the resources they have.
There is one truth I want to throw out, and you know it. We talk about doctors not available, but the truth of it is within the country we have them. The other truth is that states will not employ doctors from other states. They put them on contract. We have to face reality. We're training doctors every year, but we're training for other countries.
Somebody mentioned responsibilities. The family responsibility also is very important. If husbands are thinking their hands are clean off a woman is pregnant, which is very, very common in our environment here, the man should be involved. The man should be part of this pregnancy. And there must be policy for men to take up their responsibility. Yeah.
Wow. There's an awful lot to take in, isn't there? And there's an awful lot to reflect on. Well, first of all, information is power. Information is massive power.
Naya bitarum jaru dor. Ando metum le mam ruchaya la obule mem. Ole mem ta dumre. Aga men wonye ye me kante wonye la anda truth me babla jimla no ke. Aya mem de oro dor. Malo bamla ruchaya ta okwara le mem. Lob. Ko. Ala ngaka kwa no agri mam te kwa nwa fanot. Ai kwa meri.
I'm very poor. I have no power of money to get to the hospital.
There is no free lunch in Freetown. Even when you say it's free, somebody has to pay for it.
I think currently we're not in a very good state of affairs. I can talk specifically on basic health care because that's what's affected by the MDGs. And I think the fact that we're not able to deliver service to these gives us the bad indices that we have.
Going by the parameters we use to gauge the level of health, I would say that there are areas where we are actually getting worse.
The fact is this, they make people as if they are not human beings.
Na government hand dey now. I no get the power now. Just you get as I go talk. Maybe they no go take my word. Na 80 naira.
Gwamnati babu adalci. Dole jinya karama a yanzu a Timis ido na kwana uku yana ciwo. Kaga maganin da na je sayan sa ta akai mun 250. Yanzu idan da kyakkyawan gwamnati mai adalci zan iya zuwa in beka naira 50 ko 60 ko 40 a bani maganin. Amma kaga sai da nayi sofa sai da nayi aikin kwana guda na samu kudin maganin na je chemist na sayi.
Nigeria has some of the most expensive drugs, even the ones that are off patent that are cheap. We spend up to 10, 20 times more on some very, very basic drugs, and that comes out of the pocket of the patients themselves.
I don't man gbọ́ nínú rédíò náà dẹ̀ máa gbọ́ nínú tẹlifíṣàn tó máa sọ pé nǹkan tó bá di jẹ́ pé health center wípé hospital ọ̀fẹ́ ni ṣùgbọ́n lọ́wọ́ yìí kò sí ọ̀fẹ́ mọ́ sí ìmí ìgbà mi ta bá lọ gan tí àárẹ̀ bá ṣe pọ̀ jù bíi 2,500 máa ń bọ́ lọ́wọ́ wa bíi 3,000 náà ó máa ń bọ́ máa ní ká lọ ra abẹ́rẹ́ ká lọ ra nǹkan báyìí ká lọ ra nǹkan báyìí owó wa dẹ̀ la máa lọ fi rà.
I'm not saying there are no poor people. So what I'm saying is that when people are poor, the state should be responsible for them. But we cannot all shout and say the state should be responsible to us when we are not responsible to the state.
It's money, 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 money. And that is just that. Unless we understand that we are there to save lives, not to loot people or getting money or all that kind of a thing.
Ya zo wuni ɗaya a gida don ya koma makaranta. Sai na ji ya ce yaron kafarsa yana ciwo. Daga kafa yana ciwo ya ce kayansa yana ciwo. Ya ɗauki kayansa yana ciwo har ma ya ɗauko da wuya yana ciwo. To shine na san lalle sankarau ne. Shine na ce maza dole ne gurinmu babu mota. Babu kuma abin nan mashin. Shine na ɗauko shanuna da amalanke na sako yaron a ciki. To tafiyar mun yi ta akan awa 1.5. Na kawo shi na gudu maza dan mu zo asibiti. Muka zo asibitin Kyawa.
You see, the word here we have, the words is too congested. We need to expand the words so that, like, sometimes we admit 2 people on the bed because of congestion.
Àlẹ́ àǹfààní ìjọba kankan tó bá yá pé a máa dìbò a máa ń lo àpótí kan lọ́dọ̀ wa ń bí báyìí a máa tún lo àpótí kan ní ìṣọ́ọ̀ṣì kátólíìkì a máa tún lo àpótí kan ní ọjà lọ́hùn a máa tún lo àpótí mẹ́rin àwa máa lò ń bí mẹ́rin ni ló máa ń kún lẹ́pẹ́tẹ́ ọmọ wa máa jáde wọ́n máa dìbò tó bá fẹ́ dìbò ẹ̀ tó bá ṣe campaign wa máa ṣe agbá máa ṣe o gbogbo nǹkan tá à ń sọ yìí a máa ń sọ fún wọn tó bá lọ bọ́sà yẹn ò ná ti wà mọ́.
To ta fara naƙudan haka aka ce to a je a nemo mota kafin masu motar ma a samo su ma daga cikin gari su zo nan kowa ya ce ai hanyar ku ba kyau tunda ma motar namu nan guda ɗaya ne in ya riga fita zuwa cikin gari ba za a same shi ya dawo da wuri ba to aka zo ana ta jira a samu hanya kafin a samu motar a can da kira aka samu wani ya zo da ni ya ɗauke ta to kafin ya zo ta galabaita aka kuma ɗauka kafin a kai ga zuwa asibitin aka je nan kawo suka ce ba za su karɓe ta ba to kafin a wuce cikin gari babban asibiti rai ya halin shi da aka karɓi abin shi.
So it's essential that state governors, that state governments, that local government councillors get directly involved and hold themselves accountable for the performance of health in their communities.
The ward should be the socio-economic unit of Nigeria, just as is the political unit. When you do that, you can actually easily see what the politicians are doing in their ward. But if you know you have a primary health center there, when he comes for the election, you can ask him, what my primary health center has no tablets, no this, no drug, no doctor, no that.
We, those of us who think we know, we need to sort of like step down a bit and be a bit more humble and think about how do I give a voice to that person.
We must make health a political issue to ensure that our women don't die the way they are dying. It is an unacceptable state.
Ask Nigeria is a new communication innovation that is meant to find out what people know, what they do, and what they feel about certain health situations in their community. This new innovation actually combines social research that actually produces media products.
Ai matsalas kusan yawanci educators suke kai matansu gaskiya asibiti yawanci ba ka gaskiya
wani idan likitoci na da laifi mutanen mu na da laifi wani in yaji yana jin matsala kadan ba zai je neman maganin ta sai abin ya fi karfin sa sannan kuma yace wai yana so ya maganin abin nan kuma mafi aka sai an tashi neman abin nan zai ce kai tsaye kawai ke so ya maganin abin nan lokaci daya kuma abu ne ba mai yiwa ba wannan.
Politicians always talk like politicians. The politicians or the I don't know commissioner or whoever was talking, he said, we are the verge of sinking 60 boreholes. Are you assuring this gathering here that you are now going to sink, or you are in the process of sinking borehole in each of the health districts? Yeah? That is the thing. You make promise, you don't keep it.
Sannan hanyoyinmu kafin a zo asibitin hanyoyin sun yi gargada sosai sun ɓaci. Zai kasance idan an taso kafin a zo asibiti mutum ya jigata babu yanda zai ya kasance ya samu har ya kawo asibitin kafin ya zo asibitin ya jigata.
I would like to think that with the issue of access roads, that is something the state and the local government would have to look after.
The local government is doing everything possible to provide linkages, access roads to our communities.
I was pained at heart to see that boy die because of common malaria and because there was nobody to attend to them.
Akwai matsala guda ɗaya da muke fuskanta yanda ake gurgunta matayenmu wajen zuwa asibiti idan suka je asibiti wasu daga cikin malaman asibiti su dinga nuna musu kyara ko tsawa ko bakaƙen maganganu ko mace ta je karban kati ta bata lokaci ta ji munanan makalamai gobe fa in aka tura ta ba za ta je ba.
We have not really addressed the issue of the roles and responsibilities of the community. And if we look at the theme of our gathering, it says the health of our people, a collective responsibility.
Communities must join us. Communities must be represented, must own those programs.
We have the money to do it. We have the trained personnel, but they don't have the motivation to do it. We have money released, but they are not given to the health sector to implement programs. We must do something about it. Let every governor, let the presidency, let the local government councils put hands on deck to make sure that we're not the weeping nation of the world, because it's unacceptable that a country who prides itself as the 6th or 7th oil producing nation in the world cannot provide optimal healthcare services for its citizens. So it's a state of unacceptability. Let us move from unacceptable to an acceptable state. And the question I have for every one of you that have seen this documentary, are we going to continue to live like this? The people you saw are your sisters, they are your daughters, they are your wives that are dying. In one way or the other, we're all affected by what is happening in our local government areas, in our urban centers, in our cities, in our villages. So all hands must be on deck. If this nation is going to be strong, we must have a healthy citizen.